All right, welcome to the 2019 Benefits Open Enrollment meeting. This has been designed for those of you who are not able to attend the live sessions, but still will provide you with all of the critical information regarding open enrollment to help you make the best choices possible and to be able to have a very positive open enrollment experience. So our subject matter expert today is Tina Mays, who is our benefits manager. I'll be your host, Rich Elderkin, and I'll work with Tina to make sure that questions are addressed, which you'll see both in the chat room, as well as you'll hear from some special guests we have working with us today. One of the first questions that we like to ask our associates with regard to benefits is what concerns you the most about benefits? Now, you will not be able to participate in the chat box, but we just want to show you what a poll would look like. And as you can see, we have a couple of responses: out-of-pocket costs, cost increases, changes in coverage, and a lot of concerns around how will this affect my seeing my current doctor, who maybe I really like. So again, this question is probably, and you probably have several of these questions in your own mind. And so think about what concerns you have, and hopefully this presentation will address, if not all of them, most of them. So after you see this recorded session, I would recommend that you contact Human Resources if you have any questions whatsoever about open enrollment benefits for 2019. So as you watch this presentation, notice in the chat room there'll be some questions, and then listen for those questions from some of our participants. And hopefully, this will be a very positive experience for you this year. So Tina, with that being said, I'd like to turn it over to you and have you begin our presentation.
Great. Thank you so much, Rich. I appreciate your hosting our meeting today, and we'll go ahead and dive right in and get started for the 2019 Benefits Open Enrollment presentation. So as you can see on the screen, open enrollment is from November 5th through November 19th, 2018. The first thing I want to talk about is MasterCorp's People Proud commitment. So our commitment is to put people first, and that starts with our people. We want our associates to have quality benefits that are given with integrity, that associates can respect, depend on, and in which they can take pride. So we think you're going to love what we have in store for you for 2019. So our learning objectives today are going to be a basic knowledge of the benefit plans, upcoming changes to plans and rates, things you need to do to have benefits in 2019, and how to enroll for open enrollment. And we've got a chat participant that says hello. So hello, Megan. Thanks for joining us today. I appreciate it. So active enrollment is for 2019 this year. And what does that mean by active? That means that all associates who would like to have coverage through MasterCorp for 2019 must enroll between open enrollment dates of November 5th through the 19th. All of your current benefits are going to end on December 31st, 2018. There's a couple of reasons before that. So first of all, we have a new payroll and benefit system called UltiPro, which we're going to learn more about later. Since we're using that new system, the best way to ensure your data's integrity is to have you enroll directly into that system. Secondly, we always want to have you make thoughtful benefit choices based on you and your family's current needs. And often being able to go into a system fresh and do that is the best way to ensure that you are meeting those healthcare needs.
Hey, Tina, we got a question from Megan. Quick question.
Okay, great.
What about 401k enrollment? Do we need to re-enroll in that right now?
That's a great question, Megan. So the first part of it is that I didn't include 401k enrollment in this particular presentation because we're going over open enrollment information. And 401k is something that you have all year long that you can enroll in it or disenroll in it, contribute or not contribute, as long as you're eligible and in the plan at any time you want. So that happens and that rolls over year to year. So that's not something you have to re-enroll in. It really doesn't have anything to do with open enrollment per se.
Great, thank you.
Okay, great.
Okay, Tina.
So the first thing we're going to talk about are the benefit changes for 2019. So we've got new carriers, new benefits, improved benefits, and new benefits and payroll systems. So we're going to go in, just start talking about some of those changes that are coming up. The first thing we want to talk about, though, is who's eligible for benefits. So the first benefits we're going to talk about are medical, dental, vision, life, and disability. And also, what isn't mentioned there, also the flexible spending account plans. Those are also part of this eligibility group. So all full-time management and corporate associates and all field hourly or piece associates after 12 months of service and averaging 30 hours a week. These are the folks that are eligible for those benefits.
And it looks like we have Megan typing a question. Tina, so let's see what she has to say. So Megan asked, my child is 19, but not dependent on me. Is he eligible for anything?
Great question, Megan. So actually he is. With eligibility, as long as that person is your child, it could be an adoptive child, it could be a stepchild, but that child can be on your benefits, at least for medical, up to age 26. And that doesn't matter if that child is married. That child, if they were married, wouldn't be able to cover their spouse on your plan, but you still could add your child or keep your child on your plan at that age. There are some limitations for things like life insurance. So for child life insurance, that child would not be able to be enrolled in that plan unless they were a full-time student. If he's a full-time student, he or she, then they would be able to, if you had to show proof, you would have to show proof of that full-time student status. Great question. So Megan's asking, do I need to provide proof of anything to enroll them? And we're going to actually get into some dependent information later, but yes, you would have to provide proof. And so once we get into that dependent verification piece, we'll certainly go over what those proofs are.
Okay, great.
All right.
Thank you, thank you. All right, Tina.
So now we're going to talk about some rate changes. And we have great news in that medical and vision rates have a 0 increase. So this is something that is almost unheard of when it comes to what we call the renewal process, or looking for benefits and sourcing those for the next enrollment year. So this is a wonderful job that our benefits broker, Holmes Murphy, has been able to get us those medical and vision benefits without those rates increasing. So we're super happy about that. Most life and disability rates actually did go down. So there are a few minimal age-based rates that did increase for that, but in general, I think you'll find that most of those life and disability rates actually went down. We did have one minor increase. For dental for salaried and corporate associates will be an additional $1.15 a week. Again, that is a minimal increase, but that is going to happen for next year.
Hey, Tina, this is Rich. Do we have a cheat sheet for showing these rates?
We actually do have a cheat sheet. Well, we have something that we send out, recruiters can send out to potential new hires. That's a quick sheet and a glance for medical, dental, and vision. It's a little bit harder to represent the life and disability because they're all based on rate charts, but we do have something that's available in corporate documents and also on hr.mastercorp.com. In addition to that, anyone who has access to our benefits and payroll system, which should be all of our MasterCorp associates that are eligible for benefits, or even those that aren't eligible for benefits, they still can get into that system. But you can always go in and look at the plans that you're in and what those rates are and what you have, or if there's an open enrollment or any type of enrollment that you have open, like we're going to have during open enrollment, those rates are going to be displayed per pay period as you go through the enrollment process.
Great, thank you.
You're welcome. Any other questions?
I think we're good.
All right, let's move along. Okay, so the next thing we're going to talk about are the MasterCorp medical plans. Now, there are two medical plans, and the first one that we're going to talk about is the PPO plan, which stands for Preferred Provider Organization. And so this is a plan that probably most of you are familiar with. It's more of a traditional medical plan in that you have copays when you go to visit the doctor when you're sick. So, for instance, if you're going to see your primary care physician, you're paying a $30 copay. If you're going to see a specialist, you'd pay a $50 copay. The deductible is $3,000 for an individual and then $6,000 for the family. And then you have a coinsurance. Basically, what that means is a cost share between you and the insurance. You would be paying 20%, and the insurance plan would pay 80% until you meet that out-of-pocket maximum. Now, what that is $4,000 for an individual and $8,000 for the family. That just means the most you're ever going to pay out of your pocket per year. And then once you reach that mark, the plan would pay at 100% for any eligible costs. Prescription drugs are represented by these three copays here at the bottom. So generic prescriptions are $10. Preferred brand and non-preferred brand would also be $35 or $50. There is one caveat to the brand prescriptions. So there's an additional $200 deductible that is in addition to the $3,000 individual deductible. What that means is if you have a prescription that is a brand prescription, you're going to have to pay that first $200 of that cost and then your copay, and then the plan would pick up the rest of that cost. So that sometimes people either forget about that or maybe they're not quite aware of it. But there are times when if you do get a brand, that is going to be an additional deductible. So they're really just trying to steer you towards using generic medications, which of course are better on your pocketbook as well.
Cool. Yeah, makes sense. Hey, we have a question about, can I still use my current doctor this coming year?
So the one thing to know about using your doctors and who's in the network and such, doctors can go in and out of the network frequently, but quite often your same doctors, Blue Cross Blue Shield has a great network. It has a lot of variety in it. Chances are if your doctor was in there last year, they will be this year, but we can't guarantee that. So the one thing you'd want to do is to go to, if you live outside the state of Tennessee, you would go to bcbs.com and look up your doctors that way. So you could go and hit find a doctor and do a network search that way to see if your doctor is still included in the network. If you live in the state of Tennessee, it's a very similar website. It's bcbst.com, and you could do the same search there.
Okay, I'm going to put that up here in the chat box. So bcbst.com. Okay.
Yes, that's for people who live in the state of Tennessee.
Okay, perfect.
And then outside of Tennessee, you just drop that T, and that would be the website.
Okay. Makes sense.
Okay, great. Any other questions?
So far,
all right, so now we're going to go ahead and, I'm sorry.
Perfect. Should be on Master Wellness.
Yeah, it's actually bcbs.com.
Oh, sorry, BCBF.
Right, just basically you're taking the T off of the previous link, and that's the web address.
Okay, cool.
Okay, great, thanks. So we're going to go ahead and move on to Master Wellness, which is the companion piece for that PPO plan. So if you do choose to enroll in the PPO plan, you can save money on your monthly medical premiums by participating in the wellness program. It's super simple to qualify. Basically, all you and any adult dependents over the age of 18, or I should say 18 and older, that are covered under your medical plan, that PPO plan, just has to get an annual physical, which is covered 100% by the plan, so you don't have to pay anything out of pocket. And then you just have to show proof that that was done within 90 days after your enrollment. So in essence, the last day of March would be when you have to show that you had that annual physical. Now that physical, once you have that proof, it's usually just a note from your doctor that's on their letterhead that just says the date that you or those adult dependents had your physical. That gets sent back to the HR department or HR benefits at mastercorp.com, and then you'll be noted and you'll be covered for that entire plan year.
Hey Tina, I've got a quick question.
Okay.
I just got my physical done in October of this year. Do I need to get another one done between January 1st and March 31st to get that wellness rate?
I'm glad you asked that. So that's a great question. So no, you don't. So we want to see that you had your last annual physical in the last 12 months. So that could be from March 30th this year to March 30th last year. So you would definitely be covered, and that would be acceptable for the 2019 plan year. Just so you know, though, for the next open enrollment, you would need to show proof of a new physical because that 12-month period would have passed.
Okay, great. Thank you.
Thanks for the question. So if this isn't completed, just so you're aware, your rate will be changed to the non-wellness rate effective that 91st day from your eligibility date. So that's not something you typically get one reminder of doing your wellness, and then if that isn't done in that time frame, it's just automatically changed and you would go to the higher rate. So in essence, this is saving you money on your premiums. You get a little bit of a lower premium every month, and if you end up not completing that, then you're just switched over to the non-wellness rate. So the next thing we're going to talk about that also kind of goes along with the PPO plan are our flexible spending accounts. So we still have the same FSA vendor, which is Discovery Benefits. And even if you don't participate in MasterCorp's medical insurance, you can still participate in the healthcare flexible spending account. And we're going to go into in just a moment. There's two different types of accounts that you can sign up for. And one is the healthcare flexible spending account, and the other is the dependent care flexible spending account. And so I have a side-by-side comparison here just so you can see the different elements between the two plans, and we're going to go over what each one mean. So the first one is the healthcare flexible spending account, and that is going to allow you to set aside pre-tax dollars that come off of your check. That means before any taxes are assessed, then that money will be taken from your account. So you're going to choose on an annual amount for the year, for the plan year. You can choose up to $2,650, and what will happen is at the beginning of the year, depending on what the amount you choose, that's going to be taken out of your check in even payments for the entire year. Those funds for the healthcare flexible spending account are available on day one of the plan year. So you get a debit card from Discovery Benefits, or if you currently participate in the plan, then you'll just keep using your same card if you decide to participate in 2019. But those funds are available on day one, even though you have not fully funded it yet. You can use those funds absolutely on day one. Those funds can be used on dependents even if they're not covered under the medical plan. So that's a great benefit. The one caveat is you cannot be enrolled in the high deductible medical plan, which we'll be going over in a moment, if you have this benefit. So that is not the plan. You cannot have that with that plan. The last caveat is that this is a use it or lose it account in 2019, except for $500. So you can carry over $500 into the next plan year, but no more than that. So you definitely want to make sure that you plan wisely based on your typical medical expenses. Now, the other plan, the dependent care flexible spending account, it's a little bit different in that it's first of all used for dependent care. So what that means is children, or perhaps if you have elderly parents that are your legal dependents that you're caring for, this can provide you with a way to set aside pre-tax dollars as well, up to $5,000 to use for their care for things like daycare or elder care, so that you and your spouse could either work, look for work, or go to school full time. Those funds, though, for this plan, the dependent care plan, can only be used for qualified dependents that can be listed on your tax return. And also, you cannot use it the full amount. It only you can only use it when you have the funds deposited into the account. So that means if you have $5,000 you set aside for the year, they're going to take that out in equal amounts, and you can only use what is deposited in that account at that time. For both plans, you want to make sure that you keep all your receipts, because the IRS may decide to audit you one year and say, hey, we want to make sure you're really using these funds as you say you are. So you just want to make sure that you keep those receipts. As far as how long you keep those, you would have to talk to a tax advisor. The dependent care account is use it or lose it. There are absolutely no funds that you can carry over into the next plan year for 2019. So you definitely want to make sure you plan that also based on what your typical expenses are for those plans. All right, and we'll just move on now to the high deductible health plan. Now, the high deductible health plan is our second medical plan, and it's very different from the first medical plan in a lot of key ways. And so we're going to go over how that is different from the first right now. So high deductible health plan is exactly as the name implies. It has a high deductible of $4,000 for the individual and $8,000 for the family. Now, what you don't see on this screen is that there aren't any co-pays for seeing the doctor. Those are all subject to the deductible, meaning if you're going to the doctor because you're sick, then you're going to pay the full visit of the doctor's visit when you go. Once you reach your deductible amount, then the plan's going to pay at 100%. So you don't even have that co-insurance where you're paying a percentage and the company or the plan is. Rather, the plan's going to pay at 100% as soon as you hit that $4,000 deductible. And that's also your total out-of-pocket.
Yeah, hey, Tina, sorry to interrupt, but your voice is really kind of going in and out.
Oh, it is? I'm sorry.
Yeah, no. So I'm wondering why that is. Why don't you continue? I'll kind of keep a watch on it.
Okay, great. Let me know if I need to adjust something.
So far, so good.
So with the prescription co-pays, that's where this plan is very different from the other plan in that you're going to pay your prescription costs up the full cost until you reach your deductible amount. There is one caveat to that, and that is for prescriptions that are on what we call the 2019 preventive drug list. Now, the 2019 preventive drug list, we're going to go over here in the next slide so you can understand fully what that means. So normally, as I said, for that high deductible health plan, you have to pay all of your costs up to the deductible amount, even including prescription drugs, but there is an exception for any drugs that are listed on the 2019 preventive drug list. Oh, we've got looks like maybe a question,
Yes.
Rich.
We've got a question here from Megan. Why would I consider a high deductible health plan, and what might the benefits be?
That is a wonderful question, and I'm glad you asked that because that is probably one of the, I would say this plan is probably one of the least understood plans that there are. And that really ties into kind of the next piece that we're going into, Megan. So thanks for that question. So just to finish up on how the preventive drug list works, I'll finish that off and then we're going to go into exactly why you would consider this type of plan. So thank you for that. So for the preventive drug list, normally, as I said, you have to pay 100% of your cost for your medical or your prescription drug care, but except for these with the preventive drug list. So if you have something like diabetes, if you have asthma, if you have high blood pressure, common illnesses that a lot of people have, if your drug that you take is on the preventive drug list, then you actually only have to pay these co-pays here for that drug. There is not even that $200 brand deductible. So that is a great feature. And unfortunately, the preventive drug list hasn't come out yet. It should be out within the next 2 weeks, mid-November, we're thinking. But if your drug is on that list, then you just pay the copay. You don't have to pay the full cost. So the reason why that's important, and that kind of segues into why the high deductible plan could be a good option for someone. So the first thing is that the high deductible premiums that you're going to pay are cheaper typically. So you're not going to pay as much out of pocket whether you're paid weekly or biweekly. So that right there in itself is a plus. And if you're somebody that you don't go to the doctor except for maybe your annual physical and to get a prescription written for your maintenance drugs, so something that might be on that preventive list, then you can save money by not paying as much out of your paycheck for the PPO plan, but rather this plan because you're only paying these copays for your prescription drugs. And since your preventive costs for your medical are absolutely 100% free, so your annual physical and that sort of thing, you're not paying for that anyway, which we're going to get into here in just a moment. Those are ways right there that you can use this plan if you're somebody that you're typically healthy, other than maybe you're taking one of those maintenance drugs and you're not going to the doctor very often, you're not sick very often, then that might be a reason why the plan is for you. One of the other reasons segues into our next new feature for 2019, which is a health savings account, or HSA. So I'm super pumped about this. This is something that I've wanted MasterCorp to have for the last couple of years. So this is something that goes with that high deductible health plan. And this is going to get us, yes, Rich, yay. This is going to be a way that people can actually take control of their healthcare costs and save money for retirement. Now, that sounds kind of crazy to some people, like, wait a minute, how can a health savings account help me with my retirement or having money in retirement? And so we're going to get into just exactly how that can happen. So an HSA is a way to set aside pre-tax dollars for eligible medical expenses when you're enrolled in the high deductible health plan. So a couple slides back, we talked about flexible spending accounts, and this language sounds kind of similar, but they're very different in a couple of key ways. So first of all, the HSA is also pre-tax dollars set aside, but you can only use the funds as they're put into the account. Secondly, it has to be paired with a high deductible health plan. So you cannot have the HSA if you're in the PPO plan. Conversely, we've limited enrollment, so if you're in the PPO plan, you can't have the HSA. That is important for a reason, because the government considers it double dipping if we sort of let you have two great accounts that have pre-tax dollars savings in them that you can use on medical expenses. So you have to choose one or the other. And it's also the same sort of situation if you have a spouse at home that works and they are in a PPO plan with an FSA, a healthcare flexible spending account, and you have an HSA. You can't mix those two accounts and double dip like that. So those are important caveats to note. The great thing about the HSA is that you can contribute individually $3,500 for the year or $7,000 for your family, all pre-tax, and this rolls over from year to year. Actually, you can use this money even after retirement. So it's really great in that it's almost like a 401k savings plan, in that you can set aside pre-tax dollars. You can actually, after your account reaches the balance of $1,000, you can invest those funds just like you would in a 401k, and those earnings also stay in the account as without taxation on them. So that's wonderful for somebody who is really wanting to sock away money for retirement for healthcare expenses, because let's face it, we're all going to have healthcare expenses when we're retired and we're older. And as things get worse in the healthcare industry, we never know what those costs are going to be. So this is a wonderful way to set aside that money for you and your family. You can use this after you leave MasterCorp. We don't want you to leave, but of course, if you do leave the company, your account is yours for life. It goes with you, and you can use that until those funds are depleted or not.
Very good.
So I just want to make sure that everyone is aware, though, you cannot be enrolled in the healthcare flexible spending account or the PPO medical plan if you are in the HSA plan. So, and just to kind of recap how that could be preferential over being in the PPO plan. So if you're somebody who you're already saving money by not paying as much in your medical premiums as the PPO plan, that difference that you are saving can also be put into your HSA. So you can save money on your weekly premiums, put that money into your HSA account, and put that money toward your medical expenses in the future. And that just rolls over from year to year. So it's a win-win in that scenario.
And we hear from.
I'm glad that helps.
Makes sense. Thank you.
And then this slide is just about once your account is open. So we get your account open with HSA Bank. They do some verifications. They just do identity verifications, and then they open your account. So just like any bank, if you want to go in and register your account and be able to do online banking, then this would be the way that you do that with HSA Bank. Now, the next thing we're going to talk about is preventive healthcare services. So dependent on, no matter which plan that you're on, medical plan, so the PPO or the high deductible plan, these services are all covered at 100% in network. Now, the reason why the slide says in network is that you want to make sure that you stay in network no matter what you do. The only time you should not be in network is if you're literally stuck in a place where you have a medical emergency and there are no facilities that are in your network. Otherwise, you should really try to stay in network because you're going to get the most savings doing that. Now, with these services that are covered, so your child care, immunizations that most young children have to go through, I believe up until the age of 6, you have to get those shots and have those visits. Those are covered at 100%. Your annual well woman exam is covered at 100%. Annual mammography screening for ladies 40 and older, or the annual prostate cancer screening for a gentleman for 50 and older, those are all covered at 100%. So the one thing I like to tell people when you go to get your annual physical, and now we see there's absolutely no reason why no one should go because it's all covered 100%. You want to make sure that the doctor is fully aware and the staff is fully aware that that is your preventive wellness visit for the year, because oftentimes they still try to get a copay from you. You don't owe the copay. And they sometimes, if you're in the office visit, you're getting your screening done, and then you decide, well, I'm going to tell the doctor about these ailments or these other issues I've been having. Great thing to do because, of course, you want to communicate with your doctor, but you want to ensure that they don't then change that coding into a different type of visit. So you just want to make sure you have a clear understanding with your physician and their office when you do go in for your annual wellness visit. And then we're going to just recap the two plans side by side just so you can see the differences one last time. So as you can see, the PPO, you're paying copays when you go to the doctor. You have a lower deductible, but you're still paying coinsurance until you meet that $4,000 out of pocket, and you're paying copays when you go to get your prescriptions. For the high deductible plan, you're paying your expenses out of pocket up to that deductible amount, except for that preventive care. And then once you meet that deductible amount, the plan's going to pay everything at 100%. And you do have that preventive drug list for those prescription drugs that are subject to just a copay, which that prescription drug preventive list will be out on hr.mastercorp.com. It'll be in the corporate documents, and in the UltiPro system, our new system that we're going to talk about here momentarily, there's going to be a list there as well. So there'll be plenty of places to review that list. You can also reach out to Blue Cross Blue Shield and give them your plan information, and they will send you that list as well.
Very good.
All right, so let's move on to dental. So with dental, we're not going to go too deep into that. It's because we just have one dental plan, and the deductible for an associate or individual coverage is $50 for the year and $150 for your family. The annual benefit maximum amount is $1,000 per person. We do have coverage for orthodontia for children up to the age 19 that does not have a waiting period. So if you do have kids that need some orthodontia, then they can be covered and you don't have to wait for those services. For the vision plan, we just have one vision plan as well. It's actually a pretty great plan. You get $150 frame allowance, or if you are doing contacts, then you get that same amount towards your contacts. Those amounts, you have to choose one or the other, so you can't do both under the plan. Although if you decide to get one and get the other, then there are typically some great discounts that you can get at least on that second purchase, but the plan actually only pays for one or the other. The plan does allow you to choose either in-network or out-of-network provider, so that's really up to you and pricing out, which provider you want to go to and who you're comfortable with.
Excellent.
All right, and let's move it along here to life and disability enrollment. So this slide is, I think, one of the more important slides in this whole deck, and so there's a reason for that. For 2019 Benefits Open Enrollment, MasterCorp associates have a unique opportunity to enroll in all life and disability plans up to the guaranteed issue amount, which we'll get into what that is here in a moment, without having to fill out a health questionnaire. This is huge news, and there's a big reason why that is. So normally you cannot enroll in these plans outside of being a new hire unless you complete what's called an evidence of insurability form, and you send that to the carrier to review. Now that form is very long. It's tedious. Nobody wants to have to answer health questionnaires for themselves and their family and get into all their personal business like that. And the sad thing is that you can be denied just for, if you're completely healthy, you can be denied just for being over their weight limitations for their weight charts. So even if you're in good health. So you might be asking yourself, well, why should I care about this? there's a big reason to care about that, and that's because two of the most important benefits that you can have are disability and life insurance. A lot of people don't really realize that. Maybe they didn't get a chance to talk with me first or have an orientation to realize why maybe they should sign up for those products. And the great thing with our new carrier with Cigna for this year is that you can sign up for those things. If you missed it in the past and now you go, oh gosh, I really want short-term disability, or I really want to have voluntary life insurance, or I want to have more voluntary life insurance. I didn't realize, I got a small amount. This is the time, this enrollment, where everything is on the table. So if you didn't enroll in those things before, you can enroll in them and you're not going to have to fill out that ugly health questionnaire. So this is huge. The only caveat for voluntary life insurance is that you are capped to what we call the guaranteed issue amount. So that's the amount that the insurance company is going to give you without you answering any of those questions. Currently, for associates for voluntary life insurance, that amount is $150,000. And for spouses, that guaranteed issue amount is $50,000. So if you already have insurance over those amounts, you will have to fill out that form, the evidence of insurability, to get more insurance that's over that guaranteed issue amount. But if you have under that, if you have, $10,000, $50,000, whatever it may be, you can ratchet that right up to that $150,000 limit, no questions asked. So that's a huge deal. I highly encourage people to sign up for short-term disability and also for life insurance. Now, you do have basic life insurance through MasterCorp, but that voluntary life insurance is also important because let's talk about first disability insurance. So that offers income replacement if you're injured or you have an illness that prevents you from working, and that's a non-work related injury. So the question you need to ask yourself is, can you or your family go without a paycheck if you can't work? For most of us, the answer is no. We need all of our paychecks coming into the home. And so that's really something to think about, that, replacing that income if you can't work. The other piece to that, as far as taking care of the family, is your life insurance. So none of us want to think about dying. It's not a pleasant thought. It's going to happen to us all, but, we're here and living in the moment. But we have to prepare for all of those eventualities. And life insurance helps your family carry on with the responsibilities of life in the event that you do pass. So it's important to think about what your family is going to need in your absence. If, typically someone marries somebody, they have a family together, you're expecting, without anyone passing away early, that that person's going to be bringing an income for, 30 years or something. And that if their life is cut short, that family is then left without resources that they all were depending on. So these are important reasons for you to really consider what your family needs are for these products in 2019, since we have this incredible opportunity to kind of start with a clean slate, if you will. You can check your 2018 benefits in mymc4me.com and see what you currently have. So that's the best way going into open enrollment, is seeing what do you currently have and then talking with your family about what you need. One thing I do want to stress at the end of this portion of the presentation is put your beneficiaries into LT Pro as soon as you get in there. We didn't transfer those beneficiaries over, so everyone's going to need to do that. And that is hugely important because that's the only way we know where you want those funds to go were you to pass away. So yes, Rich, thank you. It's very, very important. I tell the story of last year how we had an associate who was 27 years old who died with 3 children and didn't leave any type, and he wasn't married to the mother, and so he didn't leave any type of message to anyone by his beneficiary saying, hey, I want my kids to have this. And though they have a natural right to have that the insurance company needs to see that there's a beneficiary listed, or they have to put it in an estate, and then this family has to go through this legal wrangling to get the money for the children out of the estate or to set that up. So you just want to make sure that you save your family that trouble by having to go through all that by just putting those beneficiaries down. You don't need a social security number for your beneficiary. You just basically need a name and I believe a date of birth, but it's super simple. So just make sure when you go into enroll that you add those beneficiaries.
You know what, Tina, it does seem if you needed a social security number, that might get people to say, well, I'll sign them up later, right, and then they forget. right?
Exactly, Rich. You're totally right. And that's why we try to make it as easy as possible so that I mean most of us aren't walking around knowing our significant others, social security number. Some of us know, but a lot of us don't. And so that is a way we've made it easier so you don't have to have that to put that beneficiary down.
And by the way, Megan has a question.
Oh,
Can we
great.
have a beneficiary from outside the USA where they don't have a social security number?
Right. That is an excellent question, and I'm glad you asked that. So, yes, you can. The one caveat to note with that is that these funds are going to be released in US dollars and typically to a bank account. And so you would just need for your beneficiaries to ensure that they would have the facilities to be able to get those funds and to have access to those funds um, coming from a U.S. Company like that. So that would be the only thing about having that. But you certainly can put anyone outside they don't have to be a U.S. citizen. They don't have to have a social security number to be able to be your beneficiary.
Okay, great. All right.
Okay, great. So let's move along. I know that one was a little long, but it's really I feel very passionately about those products. So definitely think that over as you're enrolling. So the next thing we're going to talk about is for our field hourly associates, their life and ability products. So again, they have the ability to choose whichever plans meet their needs. And so this year we've got 4 levels of voluntary life insurance coverage. Last year or I should say this year we have 3. So for 2019, we're adding that $75,000 of voluntary life insurance coverage. That also would be if you choose one of these amounts, you get that same amount in accidental death and dismemberment coverage as well. So that's important to note with those plans. And then short-term disability. So we've made a change to that as well, which we think is an enhancement for our hourly associates. So instead of doing a percentage of someone's income, with a lot of our piece rate associates, figuring out what their actual percentage of income is, since there's not a flat salary, but it's piece rate, can be difficult and unfair to some associates. And so we decided that that $250 a week is guaranteeing that you get that rate every week, and it's not going to be as subject to that percentage. So that's a flat rate that everyone who is in that field hourly category would get that for their short-term disability if they enroll in that.
Very good.
Now, for management and corporate life and disability, the basic associate life insurance is company paid. Now, that also is a companion amount for the accidental death and dismemberment. So if yours, it's basically 1 times your salary. Now, in 2018, we capped that. So your basic life and accidental death and dismemberment was $50,000 cap. So if you made $80,000, it was still capped at $50,000. And that was really just because there's a minor tax from the IRS called imputed income. And so that was the reason behind that. But we also felt that that was really not giving as rich of a benefit as we could to our associates. So you're going to find that in 2019, you still have 1 times your salary for your basic life and accidental death and dismemberment, but now it's up to $500,000. So that means if you have this life insurance and you make $100,000, then your basic life insurance and accidental death would be $100,000 each. If you were to pass away, that's what would be paid out to your family. The accidental death and dismemberment pays out if your death is deemed an accident. So that's a great boost for this year. So we get more life insurance on those amounts. Long-term disability, there's really not a change with that. It's still company paid. So you're going to find that you're automatically enrolled in that for 2019. And then short-term disability, we really don't have a change for that. This year, it's going to remain 60% of your weekly income. So with that benefit, your benefits begin on the 15th day of disability. So for those 14 days prior, we call that your elimination period or your wait period. You would just have to, if you wanted payment through those days, those 14 days while you're waiting for that 15th day to kick in and your benefits to begin, you could use any PTO or vacation time that you had to get you some income for those days that you're waiting. And then that plan pays for 11 weeks. If you happen to be on short-term disability and after 11 weeks you still can't come back to work, you're still not well enough, then that would segue into the long-term disability plan. And then maternity leave is covered pretty much as any other type of illness, but new enrollees to the plan to short-term disability should realize that that can be considered a pre-existing condition depending on when you became pregnant. So that's something you just want to discuss with me, your benefits manager, or you could talk with the carrier as well with Cigna if you had any questions about that. So now we're going to get into, we talked a little bit about eligibility prior, but we're going to get into eligibility now for these plans. So these are all new plans for MasterCorp this year, and I'm really excited that we're being able to provide these for the people that we can provide them for. So critical illness and accidental injury, legal and pet insurance. Those are all new plans. Now, critical illness and accidental injury, we're going to go into a little more in depth here in a moment, but those plans are actually replacing our 2018 cancer plan and accident plan. So we're going to talk about that further in a moment, but just so you know, for these 4 plans, we now have a new eligibility group for these benefits. So all full-time management and corporate associates, of course, will be able to have those benefits as they are eligible for benefits first of the month following 60 days of work in general. But the great news is that for our field, hourly, and peace associates, after 6 months and averaging 20 hours a week, you can enroll in these benefits. And that's a huge thing because typically right now, if you're a piece rate person or a field hourly person, you have to go through basically a 12-month process to measure your hours and ensure that you're even eligible for benefits. So while you're kind of going through that process and waiting to see if you're eligible for the whole suite of benefits through MasterCorp, you can have these 4 plans if you meet that requirement of 6 months and averaging 20 hours. So this is a way that you could have some benefit protection. Obviously, it's not the full benefits, but with critical illness and accidental injury, those 2 things right there do provide you some sort of coverage in the event of you do have a critical illness or some type of accidental injury that happens. So this is a great way for our associates that are waiting to see if they qualify for the full benefits to have some type of coverage.
Very good.
And to sort of segue into that, we're going to talk about critical illness and accidental injury a little more in depth. So right now, as I mentioned, we have the cancer plan through Guardian, and we also have the accident plan through Guardian. Those plans are going to go away as of December 31st, 2018. Now, you will have the opportunity within 30 days of that date, so basically by the end of January, you can continue those plans and port them over into an individual policy if you'd like. You would just have to contact Guardian before that 30 days are up. So after December 31st, you have 30 days to do that. Now, you don't have to have those plans as individual plans on your own. You can just go ahead and enroll in critical illness and accidental injury insurance through Cigna. Now, critical illness, we chose this plan because it does more than just cover cancer. So if you have cancer, if you have a stroke, if you have a heart attack, and there's a host of other critical illnesses that are on their list of list of conditions, you can choose either $10,000 of coverage or $20,000 of coverage in the event that you have one of those critical illnesses. So this is great, and that's not just for cancer, but it's also for other common illnesses that people may have. So this gives you extra monies in addition to whatever the health plan might pay that you might need for treatments that you might have to go to, or if you have to travel to go get those treatments and things like that. So it's a great benefit that you can choose either a low plan, the low amount, or I shouldn't say low amount, but the lower amount of $10,000 or the higher amount of $20,000. Now, accidental injury is very similar to the accident plan we have now in that it pays in the event that you or your covered dependents are injured in a non-work related accident. So there's more information when you go through the enrollment system. You're going to see some flyers and things like that, some summaries that are attached to each section of enrollment. So be on the lookout for those summaries so you can get more information on the different plans and what they mean to you and if you might want to enroll in them. All right, so now we're going to talk about one of our other new benefits, which is the Hyatt Legal Plans, or what we call Met Law. So this is simply a plan that you can get assistance with things like estate planning, family law, immigration assistance, traffic offenses, if you want to create your will. The list of possibilities is way bigger than we could contain on this slide. So it's a great way to get those things done. You have, basically your kind of own attorney in a sense that can help you with those items. The one caveat for this is that once you enroll in this plan, you have to stay in the plan for the entire plan year. So if you enroll for 2019, you're going to have it for the whole year. It's only $18 a month. And if you add up the $18 a month for the whole entire year, that's $216. Just having them create your will, the plan, what you paid, that $216 is already paid for itself, just if they create your will. So this is a great resource for people if you've got landlord-tenant issues, anything that touches on legal issues at all. This is a plan for you, I think. So you definitely want to check that out. There will be information, again, through the enrollment process on that page. But just make sure you note that once you do enroll in that plan, you have to stay in it the entire year.
Okay, cool. Very nice.
Great. So now we're going to get into the pet insurance, which apparently a lot of people are excited about because we love our furry little family members so much, and sometimes I guess our winged furry creatures. But pet insurance, so this is through Nationwide, and it covers things for your pets' injuries, illnesses. They have a preventive care plan, and so they've got various plans that you can shop with them. You can use any vet anywhere, and these plans are available for your typical dogs and cats. There's an avian plan, which is for birds, and then there's exotic pets too. So those are two separate plans. The exotic pets you actually have to call. I believe the avian and exotic pet plans you have to actually call. Oh, yeah. And Rich is asking, are snakes covered? Yes, they are actually. So that would be under the exotic pets. And so pricing is based on the kind of pet that you have and the state you reside in. So this isn't something that you're going to be able to. Rich is asking if Yetis are covered. Well, now you might have to go through a lot of press and media if you find a Yeti, but we'll have to see if Nationwide will put that on their policy. Alligators, there are people who have caimans and things like that. I don't know specifically if those types of reptiles are covered, but definitely call it Nationwide and find out. So what you'd have to do is basically call Nationwide. You can also go onto their website, which is on the notes in this slide, and it's also available through the enrollment process. So you'll have that contact information and how to get a hold of them. So you can go to their website and price things out. You can call them. I believe they did say that for birds and for exotic pets, you do actually have to call them for enrollment help. But they'll work up your quote, and if you decide to sign up with them, they're going to send us that enrollment, and then we're going to put that into your deduction. So you won't be able to physically sign up during the enrollment process other than to just go look at the information. But if you do sign up, Nationwide will communicate your information to us so that we know how much to take out of your check per week. The next thing on our list is the Employee Assistance Program, or what Cigna calls the Life Assistance Program. So this is 24/7 support. You can see the number here and also the website that you go to. So this is an added perk for having Cigna as our carrier. Now we currently have an Employee Assistance Program through One America, which is Cigna's replacing them as our carrier. And we have had some great success with using that as a company. So unfortunately, with the Vegas shooting, with that terrible tragedy, we were able to actually get counselors to go on site, bilingual, to counsel our associates for that horrible tragedy. So that was something that we got great response to. People use this program also if you just personally want to talk to a counselor. They have highly trained clinicians that can give you confidential counseling, 3 face-to-face consultations per incident per year. And they can also be a resource to you too. So it could be something to where you might have work-life issues. You might want to talk about your relationship, your marriage, parenting, senior care, a legal consultation, because you're now, and again, they have a legal consultation there too, but you can also get that through the legal plan, a little more involved, but they do have some legal consultation there as well. They can give you financial information and resources for that if you're having any financial issues. But they can also do fun stuff too. If you want to know the hottest new hot yoga studio in town, you're new to town and you want to find, certain services for you and your family, then you can just call them for those as well or go onto their website. So this is something that we utilize a lot at MasterCorp, and I highly encourage everyone who is benefits eligible. It's free to use, so absolutely go check out the Employee Assistance Program. So now we're going to do a little housekeeping, and what I mean by housekeeping, pun intended, there are certain things that associates have to do for their enrollment to be completed and be ready for the upcoming plan year in 2019. So the next few slides are just dedicated to some of those housekeeping items that you definitely want to make note of. So the first one is dependent verification. So if you add any dependents to MasterCorp's plans, you're going to be required to verify their dependent status within 30 days of your benefits eligibility date. So we do this to basically keep costs down and to ensure that the people that we're covering are the people we should be covering. And what I mean by that is we consider dependents your spouse, whether that's same sex or opposite sex, your natural or adopted children or stepchildren, or children for whom you have legal guardianship. And legal guardianship is where you have an actual court order saying you're guardian of that child. So all you have to do to verify those dependents would be send documentation to the benefits department, and examples of that documentation would be a marriage certificate for your spouse, birth or adoption certificates for children, or your completed 2017 tax return if those people are on that tax return. Now, that child person, we talked about this earlier. I believe Megan had a question about, can I have my 19-year-old? They're not dependent on me, but can they be eligible for anything? So I use the word dependents, but that person doesn't necessarily have to be dependent on you in that they're earning their living, getting their living from you. But it is somebody that can be eligible to be on your plans. So that 19-year-old child, absolutely, up to age 26 can be on your medical, up to age 19 on child life insurance unless they're a full-time student, and then they can be on child life until age 25. But those people, if they're going to be on your plans at all, then you have to show proof of that relationship to you. And so that's what we're looking for with that proof. Now, the other thing to think about with dependents would be the working spouse provision. So what that means is if your spouse works and their company provides eligible medical, or excuse me, if they're eligible through medical, for medical through their employer, you cannot add him or her to the MasterCorp medical plans. So you can add them to any other benefits for which they qualify, but they just would not be able to be added to the MasterCorp medical plans. And this just really assists MasterCorp in getting the best insurance at the most affordable rates for our associates. So just note that if your spouse does work and is eligible for medical through their employer, they cannot be added to those medical plans through MasterCorp. Now, all of your current dependents have been mapped over into the new system in UltiPro. So that means that you should not have to add any of your dependents to your record unless they're new dependents that you haven't covered before. So anyone that's new, you're going to have to be prepared to have their birth dates, their socials, when you sit down to enroll for your benefits. But if they're dependents you already had in our current system, you should see them already mapped over into UltiPro, and you won't have to do anything to them.
Great.
All right, so if we don't have any questions about dependents, we're going to move right into the enrollment instructions. So now we're just going to talk about, I'm sorry, what was that, Rich?
No, we're good. We have no other questions, but probably the big one is, how do I sign up for all this?
Yeah, and I know that a lot of people, when they call me, they get very frustrated. Why do we have to enroll again? Why do we have a new system? That kind of stuff. Because of course, a lot of employers will just let you keep everything you have, roll it over from year to year. Oh, you don't want to change anything, roll it over. And while that can be super convenient and less of a headache for all of us, because you and I, we're all associates, so it's something that we're all going to have to do. But when we have a new system, now we're always trying to get the best technology, the best products for our associates. We're really trying to put that people proud concept and commitment into action. And so this is part of that process. So it's maybe seems like a pain in the neck doing it, but really ultimately it's for the best for all of us. And what I mean by that is with this new system with UltiPro is something that is leaps and bounds better than what we have now, and it really is going to help the HR team and everyone that uses it to help administer benefits, payroll, that sort of thing. We're going to be able to give our services that we provide to MasterCorp associates in a much better fashion. And conversely, MasterCorp associates using the self-service tools are going to have much richer user experience and availability to the things that are available to them. So we feel like this is a platform that we're going to be able to really, as we grow as a company, as we have so quickly, that we're going to be able to grow with this product, and we're going to be able to deliver payroll and benefits things to you in a much more efficient and comprehensive fashion. So with that being said, let's talk about how you're going to enroll, and then we'll look at what that enrollment's going to look like in LT Pro. So the first thing here that we have for our enrollment instructions is we're going to go to hr.mastercorp.com and click on that Enroll in 2019 Benefits button. So that is our HR website, and you're going to see that banner is already there, and you're going to see that you can click on that. Now, it's not going to be active. You're not going to be able to do anything until open enrollment actually begins on Monday, November 5th, but that link is sitting there waiting for you. Now, your username and password, so once you click that link, that's going to take you to the LT Pro site. Once you click that, your username and password, so if you're a management and corporate associate, you actually got your username sent directly to you in your email with your enrollment letter. For those associates who are field and hourly associates, then that was sent to your home. Now, one thing I want to stress here is that this is the official combination that you use here. Now, the letters that were sent out to associates' homes for those hourly folks, unfortunately, the password format was communicated incorrectly to me before I sent those letters out, so I do apologize for that. This is the real, true password format here. So your username is going to be the letters M and S plus your 6-digit MasterCorp Associate ID number. So we all have a 6-digit MasterCorp Associate ID number. Even if you don't know that or don't know what it is, you do have one. So it'll be M and S with those 6 numbers right after that S. And then the password is going to be your date of birth in this format. So it'll be the 2-digit month, 2-digit day, and 4-digit year. So example, if my employee number is 123456 and my birth date is February 14th, 1958, this would be what my login would look like. For those hourly associates that we didn't send their 6-digit MasterCorp ID out to them just because, of course, it's going in U.S. mail. A lot of people don't have their addresses updated. We wouldn't want somebody to be able to do some type of identity theft for you, or on you. So those were communicated. Your 6-digit MasterCorp Associate ID number, your supervisor has that. They were sent a list with that number. And so if you do have any questions and you're a field hourly associate, just check in with your supervisor because they do have that list that has your 6-digit MasterCorp Associate ID. And just remember that the password that was format that was originally communicated in that letter was incorrect, and what you're seeing on screen now is the correct format.
Very good. Yeah, glad we got that straightened out, so thank you.
Okay, and then now we're just going to look at some screenshots for LT Pro. So once you get in there, now this is just a kind of a generic screenshot that we had, not of our actual enrollment. So when you get in there, you're not even going to really see all of the stuff that you're seeing right now because this system is not going to be live for payroll and for actual use beyond open enrollment until January 1st of 2019. So what you're actually going to see when you get in here is not going to be as busy looking as this is. But the key important points here are that here, so when you're looking at myself, this is what the first thing you're going to click on, and then you're going to click over here where it says Manage My Benefits. So using those links right there is how you're going to get into your 2019 open enrollment. All right, so we'll just go to the next screen. So once you do actually get over here, now in this area right here where it says current benefits and that sort of thing, you're going to see 2019 open enrollment. I believe that's how it presents there. So it'll say 2019 open enrollment. And then over here, there's going to be a lovely picture of some MasterCorp, a couple of MasterCorp associates smiling and looking happy. And you're also going to see you have 22 days left to enroll or whatever this is. Now this says 22 days, but yours is going to say on day one, you have 14 days to enroll or something to that effect because it's a 2-week enrollment period. This clock is always going to stay there. So if you go in day one, you make your changes, you enroll, and you're happy with your enrollment, but 2 days later you decide, I want to think about that, or I want to compare medical again, or whatever the case may be, you will see this clock is counting down, telling you how much time you have left to get in and there and make changes. But you would just click on this Get Started button, and you're going to notice here too at the top, it's not showing right here, but there's going to be a shopping cart there. So it's very similar to how we shop on Amazon and places like that. You pick items and you put them in your cart, and then you check out at the end. And so we're going to, instead of using our credit card, though, you're just going to push a button. But that's how you're going to navigate throughout this process. And so this is a screen if you want to add dependents. So if there's dependents that you had there, you should see them just like we're seeing Jane down here. You will see current family members that you have listed. If you don't have any listed and you want to add family members, then you're going to be able to click right here to add family members and then just follow those instructions. Now you will need, for anyone that you're adding for your benefits, unless it's a child under the age of 2, you should have a Social Security number for them to put into the system typically. I believe the system will allow you to put someone through without that, but you're going to be asked to make an update to that when you have that Social Security number. And then once you're inside the enrollment, so this is a representation of the medical screen. Now, of course, MasterCorp doesn't have 3 medical plans, but if you look, the plans will be side by side, and you can just click right here that's in red that says View Plan. So that's where you can just click on that, and then that's going to open up the next screen, which is going to take you through all of the benefits of that plan. It won't be comprehensive in that you're not going to see here is every single thing you need to know about the PPO plan, but it's going to have all the basic stuff, way more than what I had on the previous slide, just about copays and various popular medical things that you would have questions about. So it's going to tell you some real basic stuff about the plans so that you have a good comparison of copays and what certain visits to the doctor and tests and things like that would cost you or what you would pay. You can also, there's a comparison tool, which this is one thing I think is fabulous. So if you want to compare the high deductible health plan to the PPO plan, there is actually, and this screen doesn't show it, but you actually can click on both and then hit compare, this box that says compare, and you can actually see those plans side by side and see how they compare against each other. Again, remember though, now we have the HSA plan, so that's another thing to think about if you're thinking about that high deductible health plan, how you can set aside that money for saving with the HSA plan and the high deductible plan. Now, as you're electing benefits, you're going to see here, so it shows you up here, family that's covered. So anytime, if you're seeing a rate and you think you're looking for coverage for just yourself, and this rate here looks like, wow, that seems super high for just me, take a look over here because this is actually showing you who you're covering. So if you think, hey, I don't want me and my wife, or I don't want my kids on there, this is just for me because those kids are grown and they have their own medical plans, then you would just click right here where it says Edit Family Coverage. And that's going to take you back where you can actually uncheck that box for that spouse or those children that you might not necessarily want to cover. But you will see that this right here gives you all the rates for each type of level of coverage that there is. So you can see what those rates would be if you choose to add more family members or detract family members. Then you're going to, so on your confirmation screen, so once you're through the whole process, you've gone through everything, the first thing to note here is that your shopping cart here at the top, so it shows you what your total is. Now that is, as it says, per pay period. So if you're paid biweekly, that's the biweekly amount. If you're paid weekly, etc. So that's going to be your per pay period amount. And you'll just click down here on review and check out. And then the next screen will just provide you with the option to check out. You'll also have an option at that time. If you do have an email address that you have entered into the system, you'll be able to email yourself a confirmation, which is great. And of course, you can just always do a screenshot or print that screen if you want to just print that screen, but you can email that to yourself as well. Now, one thing I do want to note is that, in fact, let me just kind of go back here to the first kind of screen that we're going into. So if you are going through the process and you start adding your coverage, you can go up to that shopping cart and it's always going to take you back to the last screen that you completed. So for instance, I'm here and I've selected my medical plan and I get halfway through the enrollment, but I decide, you know what, I want to go back up here. I can click on that cart and it's going to bring a drop down of all of my enrollment possibilities and what I've done so far. And I can skip down to something else. But if I skip the order, as soon as I look at that benefit that I'm looking at or I make a selection, it's going to take me right back to the last thing that I needed to enroll in or I needed to look at. So the system kind of forces you to examine everything. So that's a good thing. But once you have that completion, then you're all set. You can go back into the system. It is very, yes, Rich, thank you for that. It is very easy and intuitive. And of course, HR is here to help you. So if you have any questions, of course, feel free to call us at HR at the number you see on your screen. We also have through our broker, our benefits coordinator, Maria Martinez, who is bilingual, so she does speak Spanish and English. And she can answer basic benefit questions as well. We gave her the ability to actually go into UltiPro and view things. She can't change anything, but she could confirm for you maybe what you enrolled in or if you had any questions about your information that's in the system, that type of thing. So she's available as well by voice or by email. And then you can also email hrbenefits@mastercorp.com. Now, human resources, they are reachable at hr@mastercorp.com. So everyone in human resources and corporate human resources will have the ability to reset your password. But I highly encourage everyone, these usernames are yours for the duration of your time at MasterCorp. So you want to make sure those usernames, easy to remember, it's MS plus your 6-digit ID, your MasterCorp 6-digit ID. But you just want to make sure that you keep that information in a safe place so that you don't have to reset your password and you can just continue your enrollment. And once enrollment is over with on January 1st, you'll be able to go in and view paychecks. You'll be able to print confirmation statements and do all the self-service items that you typically do now. Thanks so much, Megan. I appreciate that. Do we have any further questions for our enrollment process today?
Megan is typing again. No questions for me. No, Tina, I think we are set. I wanted to thank you for the preparation and the presentation and the time you've taken to help explain this whole process for the end of 2018. You know, from my perspective, it looks like we are able to offer our associates excellent choices without having the pain of a lot of change or increase. We've also added a number of new choices for employees. And frankly, I believe that we have a very, very good benefits plan for our associates to enjoy. So thank you very much for explaining all of it in a very quick way. Now, for those that have been watching this recording, I also highly suggest that you contact your HR professional to get copies of some of these files that those that were able to participate in the live sessions were able to download, such as a management corporate benefits guide, open enrollment, kind of questions and answers. So please ask them for copies of these materials. And I'm hoping...
Oh, you know, Rich, that's a great point, actually. I'm glad you said that. They don't even need to ask HR because they can go to, it's going to be right on hr.mastercorp.com. In fact, these documents are already there. And then they can get that in UltiPro. So there's a documents depository for all benefits documents. So that's available there. And these are also going to be available on corporate documents. I'm glad you brought that up, on corporate documents, so that supervisors can get them if they have associates who want to review or see those documents, they can print or view them from corporate documents as well.
Very cool. So to end, the purpose of this recording was to help us communicate the key aspects of the benefits program and to have you begin thinking about the kinds of choices that you would like to make. And obviously, we're here to support any way possible. So thank you very much. and have a great rest of your day.
Thanks, Rich.
Thank you.